So my name's Dan. I work for LGBT Hero. I work as a group facilitator for 3 online groups. One is South Asian Hangouts, one is 50 Plus Hangouts London, and another one is 50 Plus Hangouts in Lambeth. The idea of the groups are to reduce kind of social, geographical, cultural isolation. But today, I'm kind of interested in the topic around MPOX and sexual health. The reason why we do this webinar, it's the beginning of things really. We capture something that's like current the temperature of what's happening now. Today, it's not just about MPOX, but just general questions for the panel. So if you want to just introduce yourself, say your name, kind of what you do, and if you can, kind of what brings you here today.
I'm Harun, and I'm working as a training and volunteer coordinator for Positively UK, and I'm a sexual health and well-being worker for LGBT Hero, and I'm an individual activist and advocate working internationally, I would say, to empower people through lived experiences and to share my own experience with them, especially around sexual health and normalizing the sex conversations.
So my name is Kuljit. I'm the project lead at the Open Minds Project, which is a volunteer organization. We work to try and improve the well-being of LGBTQ plus people with South Asian and Punjabi heritage.
Hi everybody, my name is Makinder Chahal. I am currently the group facilitator for Dorsey Leicester, which is a South Asian and Middle Eastern LGBTQ plus social and support group. I've been facilitating the group for just about 9 years now. And also prior to that, I used to work in the world of sexual health promotion and HIV prevention at Trade Sexual Health in Leicester. I still volunteer for Trade now, and I continue to be a sexual health advocate, but also an advocate for promoting intersectionality within campaigns, not just within sexual health and HIV prevention, but across all LGBT kind of visibility.
Anyway, my kind of take on it is, I mean, essentially it's a normal part of development for almost all of us. In terms of, as you grow older, you know, we hit puberty, and, you know, even before puberty, there's desire and there's attraction and things. And obviously, I think the mix in which we grow up really influences the way we interpret these things. And one of the challenges that we have is that if you, and I can talk from my own experience, if you grow up in a situation where sex and sexuality is not discussed, then you have to fill in the gaps. I am now in my middle age, so when I talk about those experiences, when I was growing up, there was no internet. So if you wanted to find out about, if you wanted knowledge, you had to either go to the library, you had to talk to people, and that talking bit. So if the books weren't there in the library about what you were experiencing, then you wouldn't know still.
And for me, sex is actually no different than eating or drinking, or it's a law of nature. It is something that our body needs physically and mentally. Unfortunately, as someone Turkish, coming from very religious background, I know the struggles that, you know, the taboos surrounding the sex and sexual well-being, and how those upbringings can limit people in the further in their lives. And it can be challenging. And like Kuljit shared, that when we were growing up, I didn't have any phones. I didn't even have internet until I was 20. So I came out as a gay man when I was maybe 18, 19 years old. So having access to technology this much in this era could be something really good. But as long as we share the most up-to-date and relevant and correct information truthfully. And I always say that, you know, sex is an amazing thing, and people should be talking about it more and learn about it more, rather than making it a taboo and leaving it unknown. I have really high hopes from next generations when it comes to more open-minded and more accepted, you know, especially accepting the differences. And this can be different cultures, different sexes, different types of sex. There are always some support groups or some groups that you can go discreetly or openly to discover and to discover yourself and whatever you want to do.
I think for me, it's taking a step back and understanding how sexuality is portrayed even within wider society. So just taking a step back from being queer men, for example, and actually looking within wider society how sexuality is portrayed. A lot of the time, even from my own lived experience, you know, it's watching a movie and then, you know, a sex scene comes on and then shifty eyes and, you know, changing the channel. So kind of that kind of rhetoric, which I think continues on until this day within wider society, specifically within South Asian communities, where the expression of sexuality isn't celebrated, but when sexuality is expressed much more widely, it's often done in a really negative light, and often the sex part of sexuality is almost focused on taboos, or it's focused on kind of the negative side of sex, which then obviously is quite horrific when it's portrayed. But then there's no opposite side to that. There's no positivity. There's no celebration of expression of sexuality, and so therefore, it does, like Harun has mentioned already, it just needs to be a cultural shift in everybody feeling comfortable in expressing their sexuality in whichever way they want to do so, but also within a respectful way and an accessible way for different people, because it's not always going to be a one size fits all. And I think as South Asian queer men, we often feel that we have to kind of fit lots of our lives into different areas depending on which hat we want to wear that particular day. So if you're in quite a predominantly South Asian cultural setting, you may be toning down the queerness, whilst if you're in a very much a queer setting, you might want to tone up the queerness in order to be able to fit in. So once again, navigating those kind of spaces on top of the suppression of expression of sexuality really causes individuals to really struggle with navigating these particular spaces on how on what healthy sexual expression looks like, and also what it means to have a healthy sex life, and in turn looking after your own health overall.
Makinder, thank you for that. I mean, it's made me think about when I went out on Friday with the Gay Indian Network, which is a group in London and online and in Birmingham. And there's that 12 of us that came out that was South Asian and mixed heritage. And back in the day, if the 12 people together, getting to a club would be very difficult, but we had no problem getting anywhere. And it was quite a surprise to me. I think once you start talking about it in schools, sexual health and wellbeing, what it means, once you start talking about it in religious institutions, which is far more difficult, I think there has to be a shift that may just take time. But what Harun's saying is a shift that I'm excited as well, that things are getting better, but we need to make sure things don't fall back again either. And we can't just blame culture, religion, faith, but we need to look at the good things, I think, as well.
I think for me, it's about understanding, as I've said already, it's not a one size fits all for everybody. And I know how you've kind of reflected on the experiences of people who may have lived through Section 28, but once again, it's a very UK centric focus on how we're exploring and navigating people accessing healthcare. I think, you know, within the 21st century, we're living in the world that we are today. People are transient. People are traveling between different places, between different countries, and of course, you know, you've got refugee and asylum seekers accessing the country. We've got economic migrants going in and out of the country, people joining their families, and so one thing is not making an assumption about people knowing how the healthcare system works here in the UK, because I think it can be very overwhelming for somebody who may not be used to living in the UK to understand how the system works, what people have rights to, what people have the right to access for free, the difference between sexual health services and mainstream medical services, where the medical records are completely separate records. You know, a lot of people would just assume that one healthcare system is connected across all, so all of the information will be shared across it. So I think it's taking a step back to ensure that we're all on the same level of understanding and all at that same baseline level before sharing out wider messages. I think reducing the barriers is, I mean, it's already done a lot already, but it's going out to where these men are. And that's, you know, that could be in physical spaces, it could be in virtual spaces. And sometimes it might be in spaces that we wouldn't necessarily consider associated with queer men, because actually a lot of South Asian queer men may be integrated into wider South Asian communities, and so therefore it's about going out into those spaces, because not all South Asian queer men will feel comfortable accessing queer spaces, and of course you're going to be missing out on a whole group of individuals who won't be accessing that information if they're not in those particular spaces. So it really is about kind of broadening the scope around the visibility of sexuality and expressions of sexuality for all South Asian communities, but then also having targeted campaigns to those communities to ensure that nobody's left out.
Unfortunately, UK, while we are known being very multicultural and luckily enough in sexual health, very much advanced compared to whole around the world. But we are also very much lacking, especially when it comes to inequalities, health and inequalities in the healthcare. Localized campaigns for different demographics. This is really lacking. So I always say that training wider healthcare providers, it is really important because sexual health clinics are there. Yes, great if you are accessing them and if you are not embarrassed to go there and access help. We had an mpox crisis in the past year, and we saw how much UK struggles when it comes to localized and focused campaigns. And it's still lacking that. We did a great job giving away the vaccinations and stuff, but we really didn't think if people are not in the gay scene or accessing the gay Twitter maybe to read about the mpox or the vaccinations, what we're going to do about that. What if they don't want to be seen waiting in the queue in a sexual health clinic? How are we going to reach out to those people? Or if they don't follow anything about in the social media because of their community? We didn't think about that, and it was a little bit too late, and still many people didn't get their vaccinations into that, when it comes to mpox. So putting the information out there is great, but we have to make sure that it's widely accessible to give people an informed choices.
Well, what can I add? I think I agree with that idea of being more specific in where you can and where you should be in terms of local demographics. I know public health has been decimated in this country over the last 10 years. And I think this is one of the net effects of it, that there used to be much bigger teams that were thinking about these things. And if the wider population was more comfortable about talking about sex as a more ordinary, everyday thing, then I think that reduction in wider stigma around sexual health and sex would filter over into other populations, including some of those populations which maybe might not have, so it's not necessarily all about language, isn't it? Some of it's about, I guess, heterosexual culture and its variants. The bit that we didn't really mention in this, I guess, in terms of a barrier is fear and mistrust. So I'm just thinking about the COVID vaccinations, and I'm sure everyone's got stories of how seemingly ordinary factual information, family mixed it together with misinformation and came to their own conclusions about what was right and what was wrong. It's not always about knowledge or facts. Sometimes it's about trust and a kind of longer term kind of relationship around some of these health things. And again, our health service isn't really structured for that. So it's much kind of like crisis to crisis, big thing to big thing. But where that longitudinal, long-term work needs to happen, it's very difficult to get the investment and be that people or money.
So what you have campaigns, you have posters, I guess you got radio, television, virtual spaces. Are there any other kind of ways that could be innovative or something that's worked in the past that's worked really well that we forget about?
I think Harun touched upon it earlier, and it was to do with training of professionals. And actually, I think there's an arm of campaigns that is often forgotten when you're so focused towards getting that message out to the community directly, thinking about those indirect ways that those messages can get through. And the other thing was that I was going to mention was around accessing sexual health services not always being at the point where you're in crisis or where you're needing to access treatment or something's gone wrong, but getting into the routine of regular screening as well, I think is something that is a message that needs to be consistently shared across, which can then eradicate some of that stigma or fear of accessing services. I think on the one hand, as well as bringing accessing services to the forefront and not necessarily hiding it all behind closed doors or discrete packages. But I think that's the way you have to kind of embed that trust within the community, which we've said, to then ensure that they can access the other services when they need to.
Again, we are thinking from UK perspective because we are in the UK and then we are talking about communities in the UK, which is a good thing. But unfortunately, we don't have sexual health education in the schools. And I strongly believe that this needs to change.
It really varies between schools. Some schools are a lot more proactive than others. Of course, the when the RSC legislation came in, and specifically talking about LGBTQ plus relationships, you know, I think when it comes to anything queer sexual health related, it's definitely not there unless you're in a very progressive area where there's demand from parents to be able to provide that. So there's no consistency, and I think that's what the issue is. When there is no consistency, you are going to get pockets of individuals within society who aren't going to be receiving those messages, and that's where you're going to clearly see those health inequalities and those health disparities.
Maybe it's 16 when people are, not that all children go to college, maybe colleges have a focus. So therefore there could be more campaigns, mythbusters around kind of stigma around kind of HIV and STIs and MPOX and stuff. Maybe there could be more campaigns targeted amongst colleges like 16 plus.
I was going to, but at the same time though, Dan, although if you target it towards colleges, once again, if you're going to be getting people which have got a lower educational attainment, they're the ones who are going to face more health inequalities later on in life. So once again, you're preaching to a converted where they're already going to have wider access as opposed to those who leave school at 16. And they're really the ones who aren't going to receive any kind of information whatsoever. So I think it's, and once again, this also needs to be reflected within campaigns where we're looking at language, really simplifying the language down, using slang language, using everyday terminology, which is going to be accessible for people who finish school at 16, right the way to people who are, you know, studied masters and postgrad. Because actually, by making it that accessible, makes it kind of informal and then makes it more friendly and, you know, more user friendly across the board. Because I think as soon as you start to make it too medical, as soon as you start to use too many long words or words that people don't understand, it's going to turn people off immediately.
So often I always think if you can get siblings and parents involved, that could be a big significant, without them worrying about sexual health and realizing sex is fun as part of, like Kuljit was saying, part of just how we grow up and stuff like that. I think there are lots of innovative ways we can work, but I think it just requires all to think just outside the box. And we've all done some great work, I know that. But I think sometimes beyond kind of like social and support groups, it's beyond kind of posters and campaigns. I think it's about kind of really seeing what do the community want, like Kuljit was saying about building trust.
The other thing I will say is what Makinder said is really important. I particularly really focusing on changing the language and shifting there, making it basic. Nobody would like to talk about protein inhibitors when it comes to HIV treatment, even if they know about it. But when you make it very basic and when you tell it to people, then people understand what that virus does or that disease, that condition does and how the treatment works. They just kind of, in a very basic level, they just really embrace it much better.
Focusing around celebrations and, you know, and bringing together of people for purpose. And I think, you know, some of the best conversations you have are over food and dinner, or sharing something which takes the pressure off what you're doing to then actually share what you're there for. Because I think it's very difficult to say, come to this group, this is what we're going to talk about. It doesn't feel very organic. And I think the key element of it is to try to make it as organic as possible.
There must have been campaigns. I'm sure there must have been. I'm not sure that any really got to me.
I think a lot of the campaigns at the time were very data driven by the demographics of people who had been, you know, diagnosed with monkeypox. So therefore there was a natural sway away from specific communities or specific areas of the country where it wasn't seen as a massive issue. And as you mentioned already, Dan, around accessibility of monkeypox outside of the monkeypox vaccine outside of London was very, very scarce. And of course, you know, from a public health perspective, they've needed to put as many doses as possible in the areas where there's higher rates. So completely understand that. But I think at the same time, you know, that demographic information probably wasn't looked at enough to be able to see which people were coming forward to get tested for monkeypox.
Is it okay to ask you, Harun, of your lived experiences of mpox and kind of how you encountered maybe the support you got or not got? How was your experiences?
Mpox is disgrace of West countries and handling in a public health crisis for a condition that has been around for more than 35 years. It just showed us how much we are lacking and how much inequalities all around the world is really, really huge challenge that nobody ever thought about a disease that has been killing in Africa for 35 years. I never thought that when I had it. It started on the 7th of May in the UK. And then when I had it in June, I had no idea. And nobody heard about mpox. Nobody in the West countries, in the UK. And we handled it absolutely terrible way when it first started, because we didn't put out any information out there because we thought, I think, when I'm saying we, I'm talking about obviously our healthcare system, and they put it out there. Oh, there's a condition that is 99.9% of people are affected are gay and bisexual, and everybody was, you know, oh, okay, there is another, gays are being mischievous again, they're being promiscuous again, they're just bringing all those diseases, and it's all about sex and being gay and gay and gay. We really couldn't handle the narrative of this condition at the beginning, the government, and dropping an infectious disease on a sexual health clinic at the beginning of the condition when they had no clue about that condition was one of the mistakes. That was a good decision because sexual health clinics are amazing to handle those kind of crises, but no funding, nothing, and already a taboo, a topic that is a taboo, is dropped into a condition is dropped into sexual health clinics without any further wider picture. It was a mistake, and when I had this condition, when I laid down, you know, I thought I had COVID right after the COVID. It's a viral infection. You had high fever, you had you know, shivers and, you know, just muscle aches and stuff, and you don't think that you have another condition. And as a sexual health worker, I never heard it back in June. And it was bad because I called ambulance 5 times, and every single time they said that, you know, there's nothing wrong, that you are not an emergency. I got 41 degrees Celsius in this sofa, not being able to move or do anything, and I didn't know it was mpox. And they said that, well, just drink lots of water. This, you know, sounds like you have a just bad cold or fever. Because why we told sexual health clinics that there's something, but we forgot the other frontline workers in GPs or the A&Es. I went to A&E myself. They gave me penicillin and sent me back. And 2 days after that, my throat was shut with lesions. And I was passing out, not from eating for 3 days and drinking. And I remember somebody called me and I cried on the phone. An ambulance refused to come. And then I had to walk myself because they convinced the hospital to take me in. And 3 days after I got the diagnosis of mpox, and then after that, things got better for me. But that kind of shows the level of the trust from my perspective. So since then, I got a very bad fever, cold at the beginning of winter. And calling NHS was my last, I didn't even want to, because my trust was so much broken for suffering 3 weeks. And then 45 days suffering from a condition that nobody knew about. And obviously, it immediately reminded me of HIV and AIDS, like you said. Like, we are going through another gay plague that they are putting it out there, like that in that narrative, and then nobody knows about it. And I don't want to be the person having that difficulty and not sharing it. That was the sole reason that I didn't want to see this condition to go through and become another HIV pandemic. And then After that, I really didn't expect anybody when I'm going in the hospital sharing that photo and passing out, waking up in the morning that everybody, oh my God, this is the first time I'm seeing this on my Twitter and social media pages. Well, kind of like how? I didn't know about it and I was just blaming myself. And then I realized that all world is really blind for it. And the narrative really couldn't handle it well. And in the July and August, they came, said that, oh, we want to do more, demographic campaigns and language. I said, well, 3 months in, like Makinder said, that all Love Tank, and personally, I was, as someone who had it, and a couple of other patients around the world after that, were doing the work, and the government came in and changed the language, the terminology. It was saying that if you visited Africa, probably you had monkeypox, and then they changed it. Oh, it is an infection at the end of July, like 3 months in a pandemic and endemic, and it kind of like WHO can't decide to declare an emergency, and they couldn't agree on that until it became a heterosexual problem. It became a white man problem, and there were the first heterosexual woman cases. Suddenly, president of WHO stepped in and said that, okay, I'm going to take the decision to declare the healthcare emergency. This shows that how much LGBTQ plus community is being cared for. We suffered for 3 months and trying to help each other in the community without any support from any government or anybody. And then suddenly it became out of LGBTQ plus communities, and it became World Health Crisis. And then support started to come, and then the demographic campaign started. That was too little, too late. We helped each other already because we knew from HIV from the past. Our community is very much looking after for each other. So our attitude changes is the only thing that really saved us in the community. And I am telling it as somebody who had it and who has been working in it since then. And sadly enough, a year in, still so many people who are entitled to get the vaccine, they didn't get their second doses. It is appalling. Lots of information from CROI conference came through. Vaccination really works. And people living with HIV, if they are not on treatment, they are having impacts in a very severe. And while it's 0, if you are undetectable, the fatality, it is 30% fatality if you are not undetectable, and if your CD4 count is less than 100. So we haven't done anything for that. We haven't reached out South Asian communities. We haven't reached out Black communities until Love Tank started to give the vaccines.
I think what I wanted to ask you is that in terms of like when you were at hospital, when you were diagnosed with Mpox, what was the support like from like the nurses and doctors around you?
Luckily, I was in Royal Free Hospital, and Royal Free London was the first hospital in London that actually managed to handle COVID very properly, and they know how to fight. I must say that they really do know what they are doing when it comes to infectious diseases, and they were really good. They were really helpful, and the bigger thing is actually community support and love. Of course, like I would say 20% of them been attacking me, having sex with so many men. Like everyone was making assumptions that I was jumping from one drug party to another, using chems and having sex in the dark alleys and stuff. And 80% was love, and it was the support, and it was just people showing me this unconditional love from those people that I don't know, those doctors and everybody. That was actually really helped me to go through.
I think from a GBT MSM perspective, a lot of it is around thinking that because many GBT MSM may not be able to procreate, that actually recreational sex is seen as a bad thing. So therefore, the shame is then linked to the ability to not procreate and have sex being celebrated for procreation, and not necessarily celebrating it for recreational purposes. And that could be everything from self-pleasure right the way to having sex with multiple partners and more. So I think part of it is around destigmatizing that love for self, but then also understanding when that pleasure can become self-destructive or a coping strategy to deal with other things that people then aren't dealing with. And then, so it can go, I think exploring it from all angles, and especially from a mental health perspective as well, to get people to really understand what the benefits are to to mental health with having a healthy sex life and healthy expression of sex and sexuality, I think is something that just needs to be done. Because a lot of the time, a lot of issues do link back to an individual's mental health, or being discreet, being DL, all of these things, which then have an impact on the types of sex that people may or may not be having, or the types of sex that people may or may not want, ultimately. And I think, when it comes to the expression of sex and sexuality, Dan, I really liked your idea about having more conversations around guilt and shame, but in a much more relaxed environment. I think the one thing that initially came to me was, I know there's a lot of people who attend death cafes, having a space which is quite, a comfortable space to socially talk about death, because once again, it's one of those things that people are never prepared for it or deal with it until it happens. But talking about it quite socially and actively within a cafe space is something which has been very useful to people. So I was thinking maybe something along the lines of guilt and shame. I mean, a guilt and shame cafe does not sell to anybody. But once again, if people understand what the concept of it is, it then may work for people to then understand. And maybe it might just be, it might unlock something within people to then take action and be able to acknowledge what that feeling is within that social environment.
Well, Mick, that's really interesting. I really still believe there's lots of work that visual artists have done in terms of workshops and stuff that should be replicated across, not by us, but by people who are very creative and doing something beyond what we can do. And also it coming from communities, but also they've got to have a reason why. How does it benefit them? Why should they be involved? We can't use communities, but what you're saying, I've never heard of a death cafe. That's right up my street. Yeah, that's really interesting. I'll be Googling that. Thank you for that, Makinder. Any other final thoughts from Harun and Kuljit?
Just to say, yeah, thanks for all of that, because I think so MPOX I haven't thought about as much as I should have done, and I think so I've taken away a lot of learning. I think being reminded of that idea about like trying to design things with the people that you might want, that you're trying to involve. And I think taking Makinder, your point about the fact that sometimes people might not see any benefit in it. And if they don't, then what? If they say, well, actually, we don't want this, maybe it's about going back to the drawing board and saying, well, what are we doing here? I think the bit which, so I know it's my point, but I hadn't really thought about it before. But I think just to remind everyone watching this that straight people are having sex. Yeah, I'm sure that they are having sex. 100% sure that they're having sex, and they know how to find things about sex, and I'm sure they're all accessing porn. And I know there's inequalities between men and women, but I'm hopeful that they are evening out in terms of information. So even if people aren't talking about it, I think behind, they're doing it. So don't feel like, although we're having this conversation here, it's a wider thing.
Yeah, and I think, like one of the panelists have suggested, I think straight people also have an anal sex, and oral sex, and fisting, and sex.
Anal sex is going up, right, in terms of popularity.
It also has been people talking about, gay men cruising and stuff like that. It's bullshit. People have been cruising for years, thousands of years. It's not our thing. It's everyone's thing. Thank you for that, Kuljit. Harun, final thoughts from yourself?
I just want to thank everybody. Like you said, everybody is having sex. There is nothing wrong with it. And I really do hope somebody watching this can have encouraged enough to ask the questions they would like to ask, rather than keeping them to themselves, or just, get the right information, contact us to have a conversation, and join any support group that any of those beautiful organizations are actually putting out there. So that's really how it starts, just to taking the first step and asking the first question. And then take it from there, really, baby steps. But yes, everybody is having sex, and just have sex. It makes life much, bearable and beautiful. Just have it.
It does, Harun. Thank you for your honesty today. And people also forget that having intimacy with yourself, whether it's sexual pleasure or whether it's like physical or mental pleasure, is very important. For example, I quite enjoy going to cinema on my own, or going to theatre on my own sometimes, and that quietness is really important. But you're all invited to my next South Asian Hangouts, because we're talking about sex and having fun and what it means. So, but I just want to finish by saying thank you for today. It's gone beyond my expectations. It's good to learn stuff, and it's really given me lots to think about. But yeah, thank you. Enjoy your evening. And thank you to each and every one of you. And you can go off mute now, it's fine. I'll stop recording in a bit. I'll stop now, but thank you and have a great evening, yeah?